I will tell you about the characteristics of Staphylococcus aureus, a bacterium that can cause various infections in humans. Staphylococcus aureus is a gram-positive spherical cluster-forming bacterium that is non-motile and non-spore-forming, a facultative anaerobe that can grow with or without oxygen, catalase-positive, meaning it can break down hydrogen peroxide into water and oxygen, coagulase-positive, meaning it can produce an enzyme that clots plasma, able to ferment glucose and mannitol, producing mainly lactic acid and lowering the pH of the medium, usually forming golden yellow colonies on agar plates due to the production of a pigment called staphyloxanthin. A common member of the normal flora of the skin and mucous membranes, especially in the nose and pharynx. An opportunistic pathogen that can cause various infections, ranging from minor skin infections to life-threatening diseases such as pneumonia, endocarditis, septicemia, and toxic shock syndrome, producing various virulence factors such as cell wall components, enzymes, and toxins that help it evade the host immune system and damage the host tissues. One of the leading causes of hospital-acquired infections and antibiotic resistance, especially methicillin-resistant Staphylococcus aureus, MRSA. I hope this gives you a brief overview of Staphylococcus aureus and its characteristics. If you have any questions or comments, please feel free to leave them below. Thank you for watching.